Under the Needle, where acupuncture meets anatomy. Today, we're exploring gallbladder 20, one of the most commonly used points in clinical practice. Gallbladder 20 is located in a layered and dense region just below the occiput and the depression between the sternocleidomastoid and upper trapezius. To locate the point, start by identifying the occipital ridge and slide laterally until you feel the soft depression inferior to the bone. Instruct the patient to rotate their head gently to the opposite side, which will activate the sternocleidomastoid anteriorly. Deep to this region lies the splenius capitis, semispinalis capitis, and the suboccipital muscles. Angle the needle slightly toward the contralateral eye or nose. Avoid deep medial insertion to avoid contact with the vertebral artery, which lies anterior and medial to the point. Gallbladder 20 overlies the greater occipital nerve, which originates from the posterior ramus of the second cervical nerve. The second cervical nerve, or C2, shares a convergence with trigeminal afferents, known as the Trigeminocervical convergence. This convergence explains why upper cervical dysfunction can produce the following conditions: frontal headaches, orbital pain, and tension in the temporal region. When we stimulate gallbladder 20, we simultaneously influence C2 afferent input, which in turn interacts with trigeminal pathways. Gallbladder 20 is an effective point to reduce migraines and cervicogenic headaches. The upper cervical spine has high proprioceptive density, many of the muscle spindles being found in the suboccipital muscles. The suboccipital muscles aren't prime movers. Rather, they regulate head position and aid in visual stabilization. Chronic forward head posture results in cervical extension, increasing suboccipital compression, which in turn increases afferent signaling to C2. Compression of the suboccipital muscles may also influence dural tension. When tone reduces in this region, through the insertion of a needle at gallbladder 20, for example, patients often report clearer head sensation, reduced eye pressure, and improved neck rotation. Gallbladder 20 sits at the interface of muscle, nerve, and dura, making it a neurological gateway. In traditional Chinese medicine, gallbladder 20 is used to expel wind, clear the head, and subdue internal wind. Through the lens of a modern or Western interpretation, this equates to reducing unstable upper cervical afferent input, modulating trigeminocervical sensitization, and calming central sensory amplification. Of note, wind can be viewed as unstable neural signaling. This makes gallbladder 20 effective for treating headaches, dizziness, and neck tension. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.